Preparation of equipment for removing stitches or staplers. Sterile dressing set. 70% of alcohol solution. Antiseptic solution or Bestadine. Blade number 11. Medical stapler remover. Sterile scissors. Micropore tape. Conform bandage. Fixomol stretch. Elastic bandage. Disposable gloves. Doctor's order. Plastic bag or infection trash container.
Hello, do you have an appointment for removing your stitch, right?
Preparation procedure before removing stitches. Check the client's name and surname name to match the doctor's order. Explain the procedure to the client. Wash your hands clean. Open dressing set. Pour alcohol solution and betadine on the cotton and holes tray. And pick blade number 11. Or use stapler remover or sterile scissors to suit the stitching characteristics of surgical incisions. Prepare wound cover equipment such as micropore tape, conform or elastic bandage by choosing to suit the size, position and appearance of the incision. Practical procedures. Put on gloves. Position the client appropriately. Remove the gauze to open the surgical wound. Throw it in the plastic bag or trash can. If the gauze is very dirty, change the new pair of gloves. Removing the stitches or staplers. Grab a forceps. Pick a cotton with alcohol solution. Clean the surgical wound area. Wipe from the inside to outside. Wipe until the wound is clean. Use the stapler remover. We can keep the package of the stapler remover to place the stapler after removed. Insert the remover under the staple. Slide the lower jaw of the remover beneath the middle of the staple. Gently squeeze the remover and lift the staple gently. Place the stapler directly into a sharps container or this bag. While doing the procedure, the wound was observed with a surgical wound that the wound must be dry. No secretions or discharge. There is no redness or inflammation. The tissue of the wound must be closely attached.
Does it hurt?
Repeat for each staple, one at a time. Remove it until it runs out.
Does it hurt?
Ask the client. And then observe the wound appearance. No bleed or secretions. The wound is smooth. Almost done. About 2 staplers. Then put the stapler remover in the tray. Clean the area again. Wipe from the inside out. Clean the wound with antiseptic. Press gently down to the staples hole. This is to prevent the infection from going down to the whole of stapler's area. Wipe until the wound clean. Cover with a sterile dressing. Because the patient is an outpatient, we need to use fixumal stretch to make sure that the wound was covered well. To make it easy, you can remove the gloves, so that our gloves are not attached to the fixumal. When covering the wound with fixumal, it should be applied snugly against the skin, approximately 1 inch away from the gauze. Tell the client that, when you go home, you have to keep the wound dry. If there is pus or discharge at the wound, must come to see the doctor. The next is a demonstration of stitches removing in simple suture. The equipment: sterile scissors, blade number 11. Here you will use the number 11 blade. Demonstrate by using a blade. First, pick up the gauze for placing the stitches after removed. Open the blade envelope. Let the sharp side of blade turn to non-dominant hand side. Use dominant hand pick the blade. The non-dominant hand held the forceps. After the wound has been cleaned, hold the knot of the suture gently with sterile forceps. Lift the knot slightly off the skin to create space under the suture loop. Slide the blade under the suture loop, as close to the skin as possible. Gently pull the knot with forceps to remove the entire suture. The cut end should pass through the skin, minimizing contamination. Do not pull the exposed, dirty end under the skin. Cut the stitches until the whole wound is exhausted, and notice if there is residual stitch. Then, clean the wound thoroughly. Cover the wound with aseptic technique. Documentation. Record the wound characteristic. No stapler or stitch or the residue. Then, store equipment in place. Remove gloves and wash hands. Return the client's documents at the outpatient department.